kujua ticha. Kwa sababu hawa wanakaa
Up to 80% of households in Kenya and across sub-Saharan Africa rely on solid fuels including wood or charcoal for cooking and heating. In rural homes, wood is still by far the most commonly used cooking fuel, along with some use of charcoal, and especially for heating in colder areas of the country. In urban areas, where wood is difficult and costly to obtain, charcoal is the most important cooking fuel for those not using LPG, that is, the cooking gas or other clean options. Charcoal is also widely used in urban homes for heating during colder seasons. When used in open fires, traditional stoves and jikos, these solid fuels, wood and charcoal, emit high levels of health-damaging air pollutants, including particulate matter and carbon monoxide. While burning of all fuels produces some carbon monoxide, charcoal tends to emit higher concentration than most on account of its chemical makeup. And while the adverse effects of particulate matter are widely acknowledged, the risk of death and illness from carbon monoxide, the subject matter of this film, are still not getting the attention they deserve.
This was a very young man who was actually in a foreign land because he was coming from far away. That was where he was living was not even his local, was not his rural home. He had just come to seek for employment. And this person had a family, a wife, a son who was around 3 years old, and the wife was expectant. So this man works in the construction business. He's just the manual laborers, these people who work in construction. So they wake up very early, go to look for jobs, and then they come back probably late and too tired. So the wife lit this charcoal jiko. When they were going to sleep, they put our traditional food, which is called githeri. That is a dry maize and beans mixed up. So the intention was to cook it overnight. So in the morning, it's ready for the man to be packed for and go to work. So what happened is that they lit the jiko, they put the food, they set the food in the fire, and they went to sleep. In the middle of the night, this man wakes up. So when he woke up, he realized that actually he was quite weak. So he managed to pull himself out of the bed, and then also tried to look at the wife who was asleep, tried to wake her up. She could not wake up. So what happened is that even the child, he also tried to wake him up, the 3-year-old. He was also quite in a, very, very weak. So he pulled himself out of the house, went and called the neighbors. They came and tried to pick the child, and then the wife was actually not responsive. So the wife, of course, having been pronounced dead, together with the unborn fetus, now that was another story for the day. But the good thing is that at least the child, the boy child, was able to be resuscitated, and the man was also given first aid, and they improved. But this was a classical case of carbon monoxide poisoning. Unfortunate because it could have been prevented.
I'm in Mukuru kwa Ruben, an informal settlement in Nairobi, at a house which, like most of the homes here, uses charcoal as the main cooking fuel. The levels of carbon monoxide pollution in homes from burning charcoal and other solid fuels can be measured using so-called electrochemical monitors, such as this Lasker instrument. For concentration in the homes, the instrument is placed about 1.5 meters from the stove and left running for 24 or 48 hours. Measurements of the cook's exposure to carbon monoxide is carried out by placing the same instrument in a pouch on a specially designed apron so that this is close to where she is breathing. The Lasker has an audible bleeping alarm and a flashing LED which alerts the user when safe levels are exceeded, as we can see and hear in this kitchen using a charcoal stove. On completion of the measurement period, the data are downloaded and the levels can be compared with the standards, that is, the World Health Organization air quality guidelines levels.
Okay, kindly let me check them.
These safety levels are 35 milligrams per cubic meter for short-term exposure of 1 hour and just 4 milligrams per cubic meter for a whole 24-hour period. As we can see in this example, the recorded concentration of carbon monoxide is well above the 1 hour safe levels. We have seen the levels of carbon monoxide can be really very high in households using charcoal. I'm going to talk to Virginia Moses, a clinical officer who works in a community link facility near Eldoret, about health effects of exposure to this amount of carbon monoxide.
My clinical experience here at our facility, we've been having patients presenting with coughing, chest pain, dizziness, vomiting, and nausea. We also have some severe cases whereby the patient presents with unconsciousness.
A feature of carbon monoxide that makes it especially dangerous in homes is that people do not recognize when it is present, even at high levels.
The reason why carbon monoxide is a silent killer is because it is tasteless. You cannot taste it. It is colorless. Also, it is odorless. Yeah, you cannot smell it. That is why I think most people are not recognizing that it is silent killer, because they don't know how it kills. Hence, the deaths which occur at the community level are not reported at the facility as the cause of carbon monoxide.
The Global Burden of Disease Project estimates that around 6,000 deaths from carbon monoxide poisoning occur each year across sub-Saharan Africa, and 420 for Kenya. But as Virginia has explained, because of underreporting, the true number is likely to be even higher. Carbon monoxide can also cause serious damage to the health of people exposed to lower levels over weeks, months, and years, as may be experienced by people regularly cooking or heating with charcoal, wood, and other solid fuels. These longer-term health effects include chronic respiratory and cardiovascular disease, and exposure during pregnancy can result in a baby with low birth weight.
Sharon, na kuona wewe uko sawa. Uko sawa. Wewe ni miezi mingapi saa hizi?
5 months sasa.
Oh, ni 5? Oh. Lakini hiyo ni vizuri. So very soon utakuwa unapata mtoto. Tunakuambia mazuri.
So, what can be done to avoid this toll of illness and death from carbon monoxide in homes? The goal must be to transition to fuels such as LPG, ethanol, electricity, and other clean cooking fuels, and to do so as soon as it is practical and affordable. But in the meantime, there's a lot that can be done to reduce the risks by raising awareness of the dangers of carbon monoxide and by improving ventilation when jikos are in use.
Sukuma kabisa. Sawa hapo ni sasa baba B, na hii nayo una make sure dirisha umefungua kwa sababu hewa nayo iflow tu vizuri. Njoo wakati unapika unaweza kuwa umewakisha jiko ya makaa. Jiko ya makaa iko na ile carbon monoxide. Mnafuruta mkiwa kwa nyumba.
The Minister of Health realized that we are losing about 23,000 deaths per year due to household air pollution, and this includes even the deaths that are occurring due to carbon monoxide poisoning. But what the government actually did, through the Minister of Health, they requested University of Liverpool to see how they can develop a training manual that can sensitize the communities in their households on how to reduce this exposure to household air pollution. The community health promoters, who were formerly known as community health volunteers, are the persons who normally visit every household once in a month to pass messages on prevention of diseases. And one of the diseases is these ones which are arised due to household air pollution. This module 14, which was prepared, it makes the community health promoters to interact with their households so that they encourage the household members to use clean fuel for cooking, and not only to encourage them to use clean fuel, because some of them cannot afford. Those ones who cannot afford immediately, they are now then encouraged to have the houses well ventilated, and as well also to keep those vulnerable populations like the pregnant women, the very young children, and the very elderly to be a little bit far from the polluting sources. The manual was launched in November 2021, and when it was launched, the Ministry of Health, through support of partners, they managed to train adequate training of trainers in all the counties. And apart from training of trainers, they also sensitized all the county health management teams so that they can support this kind of training in terms of resources and the personnel.
Once trained, the community health worker delivered their health messaging about household air pollution to both community and individual household levels. For the community, this typically involves a community dialogue day meeting with discussions facilitated by the community health workers, the use of posters based on the job aids, and contribution from professionals, for example, the clinical officer from the Link Health Facility. The health messaging, promoted through Module 14, is proving to be very effective, as shown by experience following recent training of community health workers coordinated by Moi University in Eldoret.
So I can now show you the real picture of what really happened at Mama Sam's place.
Yes.
So due to carbon monoxide poisoning, since the gas, it is toxic, you can't smell, yes. It is invisible,
You cannot see it, yes.
And it causes death. It's been taken as a silent killer, yes. Within the community, because we've realized that Mama Sam lost the child unknowingly, because she thought that using the jiko, it was just normal as even usual, closing, yes. The door and the window, yes. Without any ventilation.
So that's what exactly happens to me. Whenever I cook, I normally close my door. And that most of the times I experience that severe headache. My young boy can faint there. We can sometimes I feel chest pains.
Yeah.
But because that is the only means that I can afford, what will I do? I don't have any other alternative. Or is there any other alternative that I can use instead of using the jiko?
There is an alternative.
Okay.
There is clean energy. You've heard about gas?
Yes.
Yeah.
Gas.
So instead of using charcoal, we can use gas. It's clean, it's safe, it saves time.
Yes.
It has no disease burden. As long as it's used properly, it's safe.
But what about the expenses? It's more costly.
In our chart, we have a comparison.
Okay.
We can compare the cost of use of charcoal and clean energy, the LPG gas.
Yes.
So, in a day, how much do you use for charcoal?
Per day, I use 100 shillings.
100 shillings.
That is 2 tins per day.
So, in a month, we have 3,000 shillings.
Yes.
So, 3,000 shillings is the cost of that, the empty cylinder of gas.
Okay.
A 6 kg. So, as women, we have merry-go-round.
Yes.
We have chamas. If you can save small,
Yes.
maybe 50 bob
Yes.
in a day, do you think you can move? Hi, Sheila. How are you?
I'm very fine.
How have you been doing?
Awesome. I thank God.
You can
How
go.
is you?
I'm good.
Yes, welcome.
Thank you so much. How are you doing with the clean energy?
Okay, so far, I want to thank you first for the information you gave it to me. When I went to merry-go-round,
Yeah.
I was given some amount. I think I've told you that I was given a cylinder by a neighbor.
Yes.
Who was shifting.
That was
When
great.
when I was given some amount from the merry-go-round table,
Yes.
I came and refilled the cylinder. Now I have the gas. I've been using the gas since then.
That's wonderful.
Yes.
How about the disease burden since you moved to clean energy?
Yeah, the diseases have been minimized.
Yeah.
I think it is because of the transformation from the jiko to the gas.
Yeah, to clean.
Then the cleanness. The environment now is very clean. When you look at where we prepare food from, it is very clean.
Yeah.
Yeah. And like when we were using the jiko, the charcoal. Yes. There were my friends who came in. They were still using the jiko, the charcoal.
Yes.
Then there is a neighbor also who moved in.
Yes.
She was using firewood, she was using charcoal.
And maize cobs.
Yeah, and maize cobs and cow dung. So she came in.
Yeah.
I introduced her to my gas, and I talked to her about the disadvantages of using the jiko, the charcoal jiko, and we compared the charcoal jiko with the gas, and she was very happy.
You did the cost comparison?
Yeah, we did the cost comparison, and she saw that it was at least fair using the gas.
Yes.
Now she also inquired where I bought the cylinder, but I told her that this one I was given by a neighbor, but I introduced her
to Chama,
that merry-go-round of mine, and we went there. Within a month, she bought a cylinder.
Yes,
and
that is
she
nice.
refilled. Now she's transformed from the jiko. She's using a gas now.
This case study shows the great potential of community health worker training. Sheila has switched to cooking on LPG, and her family have felt the benefit in terms of their health and a cleaner home. In addition, she has influenced her neighbors to change to clean fuel. Ask anyone in this country, and they're very likely to be able to tell you a tragic story of a loved one, a neighbor, or an acquaintance who has died from exposure to toxic levels of carbon monoxide. Here is another sadly typical account of an entirely preventable death of two young women from Nairobi who were celebrating a New Year Eve. This story also shows how the trained community health workers can mount a response to help prevent more of these terrible events from happening in future. Let's talk about carbon monoxide poisoning from the community health perspective.
Yes. Now, carbon monoxide and us in the community, we know it as household air pollution. It's a very critical thing right now because just the other day, we were coming into the new year, some two ladies somewhere in Isili decided to enjoy supper as they wait for midnight.
Yes.
And they prepared supper. They used a charcoal jiko in their household. They fell asleep before even putting on the jiko.
Yeah.
But now in the morning, the neighbors were like, where are our neighbors? And they wondered where they are. So at around 10 a.m., they knocked their doors. They couldn't open. They had to break in. Unfortunately, the ladies had rested. So, and they passed on, and there was a jiko there. So it was so clear it was carbon monoxide poisoning. So we have our community health promoters who immediately alerted us in our WhatsApp groups, and we told them to trigger community dialogues and to use the job aid for household air pollution and have community dialogues, visit the households and let people know at least they should not use a jiko in a household. And if they at all they have to do that, they open up the windows, the door for ventilation, and probably after cooking, they move out the jiko. So it's something that right now we are really looking at because we have lost so many. That is a case that we've heard of. There are others that were here also in Mukuru and many others.
Air pollution from household use of charcoal, wood, and kerosene continues to place a very huge burden on the health of Kenyans. This film has focused on one aspect of these health effects, the widespread illness of carbon monoxide poisoning including a substantial but underreported number of deaths. Tragically, these deaths often occur among young children and adults who are otherwise healthy. Yet, we know the cause, and these cases should be easy to prevent. The community health worker training is making a valuable and effective contribution, but more is needed to raise awareness across the country, and most important of all, to accelerate the transition of all households to clean fuels.